Hello everyone, I am Dr. Chinnababu Sunkavalli, Robotic Surgical Oncology in Hyderabad. Today I will be talking about what are the steps to prevent cervical cancer. So how can we prevent cervical cancer? So the two most important things you can do to prevent cervical cancer are to get the HPV vaccination, and the second is to be tested regularly. So based on your age, take the vaccine and get testing done regularly for screening. So the first way is to find and treat precancerous lesions, and before they even become invasive lesions, we can find out. And the second one is even to prevent the precancer. So the two methods, the vaccination will even prevent the precancers, and screening will help us to find the precancers early before it becomes invasive cancer. So number one, how do we find the cervical precancers? The cervical precancers, the best method to find out is to do a screening test. The screening test can be a pap smear or a pap test, which can take a few cells from the cervix as a brushing or a scraping of the cells, and that will help us to know whether the precancer is begun or not. The second test is HPV testing, human papilloma virus testing, and this is a very good test available to screen for cervical cancer. So basically the HPV testing is helping us to know the infection of the high risk types is there or not, and likelihood of precancers for you or not. So based on that, you can be treated either with the vaccine if you are not infected, or if you are infected, the precancer lesions can be treated. So things to do to prevent cancer, precancer and cancer. So what can you do to prevent both of them, both the cancer and the precancer? So based on your age, based on the overall health and the personal risk for cervical cancer, there are some things that you can do to prevent the precancer and the cancer. So number one, as I mentioned before, get a HPV vaccine. So especially the vaccines are very, very useful if they are given even before the sexual onset of activity of sexual exposure. So basically it should be given before someone is exposed to HPV. So if you are giving this vaccine after exposure, there is no benefit at all. So the American Society recommends that the vaccination should be given to children between the age of 9 and 12. So teens is the best age to be given, and children between 13 to 26 also not gotten their shots can take the vaccine as soon as possible. So young adults vaccination is usually protective if you give before the exposure, as I mentioned. So there is no benefit of this vaccine if you give after 26 years of age. So limit the exposure to HPV, limit the sexual exposure, use a condom if need be, and do not smoke or do not consume more alcohol as other preventive methods. But the most important thing is to be vaccinated based on your age, especially the teens, the girls needs to be vaccinated. Even the boys can be vaccinated, because the HPV can also lead to oropharyngeal or head and neck cancers in men as well. So please beware and take vaccine and get screened for cervical cancer. Thank you so much for watching this video.